Hey everyone, I'm Dr. Michael Breus, the sleep doctor. It's not uncommon for many of us to enjoy an occasional alcoholic beverage. Maybe it's a glass of wine with dinner, a cold beer on a summer night, or even a social drink with friends. But as so many good things, alcohol is best enjoyed in moderation. Drinking to excess can come back and bite you in the butt the next day in the form of the dreaded hangover. Of course, there are tons of supposed cures for that exhausted morning after feeling. Turns out sleep is one of the more common remedies, but my one question that's been on my mind is, can a good night's sleep actually prevent a hangover? I'll get to that shortly. Right now, let's take a look at what a hangover looks like, just in case you're watching this for a friend. If you ever had too much to drink, you're likely already familiar with the next day symptoms, which can include headache, nausea, vomiting, or an upset stomach, increased sensitivity to light and sound, irritability, dizziness, dry mouth and dehydration, as well as poor or insufficient sleep. Remember, these symptoms are all related to the way alcohol affects your body. Remember, alcohol is a diuretic, which causes you to urinate more. This is often beyond the added fluid intake from your gin and tonic, beer, or wine. And that excess water loss can lead to dehydration. Drinking can also cause your blood sugar to drop, leading to fatigue and weakness, make your blood vessels expand, causing headaches, and it also irritates your stomach, potentially resulting in pain and, in extreme cases, vomiting. So with all these unpleasant symptoms, it's no wonder that people are always searching for the elusive hangover cure. But does sleep count as a cure? To be honest, yes and maybe no. A good night's sleep won't prevent a hangover or cure it once you have one, but it can certainly help reduce the severity of your symptoms. Now, a good night's sleep includes both the amount and kind of sleep you get. We're talking both quality and quantity here. Let's look at some research. A Dutch study found that less sleep led to a more severe hangover, while an Australian study noted that more severe hangovers were connected to poor quality sleep. Okay, but what if you struggle to get a good night's sleep after a night of drinking? One question I'm often asked is, will a nap help? This time, I can answer definitively, you bet a nap can help you recover from a hangover. Nappers get the positive effects of more restorative sleep while their bodies work to eliminate any lingering effects of the alcohol. For the most productive nap, I recommend keeping it short. Less than 90 minutes is a good number to shoot for. That way, you can take advantage of the nap's benefits without any of the brain fog you might get from napping too long. But again, naps can help a hangover, they won't cure it. And while there are a lot of hangover cures out there, most of them are kind of bogus, like drinking more alcohol, consuming caffeine, eating burnt toast, exercising, or taking vitamin C just aren't going to help. There's only one surefire cure for a hangover, and that's prevention. Keeping alcohol consumption in moderation can prevent those nasty hangover symptoms and protect your sleep. And that last part is really important. For many people who struggle to get a good night's sleep, alcohol is often the sleep aid of choice. Believe it or not, more people drink themselves to sleep than any other substance, including sleeping pills. And while its sedative effect can help you fall asleep faster, sleep and alcohol do not mix. Consuming alcohol before bed affects how much time you spend in REM sleep and deep sleep, meaning that it can be seriously detrimental to sleep's rejuvenating effects. It can also contribute to snoring and throw off your circadian rhythm and anger your bed partner as well. That all sounds pretty miserable, but I've got some tips to help you feel your best when the morning comes, even after a nightcap. To begin with, drink lots of water. Remember, a major factor of hangovers is dehydration. Try my 1-for-1 rule, which means for every alcoholic drink you have, drink a glass of water. Next, get plenty of electrolytes. Water is best for preventing dehydration, but drinking fluids with electrolytes can help your body lose less water and push off potential headaches. Finally, stop drinking alcohol at least 3 hours before bedtime. Remember, there's a really big difference between going to bed and passing out. This may be the most important one to remember. Limiting your alcohol intake before you hit the hay gives your body time to clear it from your system, which does wonders for your sleep quality. One last note, if you find you're using alcohol to help you sleep or if it's ruining your rest, it might be the sign of another problem. Be sure to talk with your doctor. They can help you make sense of your symptoms and potentially get tested for sleep disorders. Otherwise, as I've said, it's okay to drink alcohol in moderation. I personally enjoy an occasional craft beer, glass of wine, or even a whiskey on special occasions with my family and friends. Just remember to keep it to a reasonable amount and give yourself some time before bed so you can get the quality sleep you need. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.